So my options are I can get the other spots biopsied, or I can opt to do and then have a lumpectomy if it's only one spot that's concerning, or I can opt to do a mastectomy. And because my type of cancer is HR2 positive, which is very bad because it's a very aggressive type of cancer. And mind you, I had my mammogram 11 months prior to the one I had in March. Nothing was there. I had a breast ultrasound a month later. Nothing was there. So I go through the process of discussing it with her, and I say, well, I want to have a mastectomy because I don't want to have to worry about those other spots. I don't want to have to get additional biopsies, which will delay my treatment in this cancer, and this aggressive type of cancer. So I just want to take care of it as soon as possible. So she's agreed with that. And then the options became whether I want to have reconstruction or not. So I'm not a vain person. As you can see, I have no hair. I don't care how I look. You know, hair does not define me. My breast does not define who I am. It doesn't make my character. It doesn't just make me who I am. It just happens to be an extension of my body, an extension of me being a woman. So I decide to just go see the plastic surgeon to do, you know, as a, you know, kind of research and, you know, detail my options, find out my options. Again, I used ChatGPT before my consultation. Great. Gave me option. I saw Dr. Tang, who is in Charlotte, North Carolina at the Levine Cancer Institute. Excellent. Great. He answered all of my questions. We discussed the what ifs. And so I decided to get a reconstruction surgery. So my surgery is supposed to be nipple sparing. And so after more research on the type of cancer that I have, and going to have my genetic testing, which tests for, there's 17 now known cancer genes, and also having a consultation with a radiologist, I made a different decision.